Create a 8 minutes video for YouTube about internal parts of human body. 2.2 Internal parts of human body. Humans may look different, but inside they share identical component parts. The human body contains major internal organs or body parts which can be easily identified. These organs differ in size, shape, location, and function. To survive and reproduce, the human body relies on major internal body organs to perform certain vital functions. When two or more organs, along with their associated structures, work together, they become component parts of a body system. There are many of these internal organs that are a vital part of the body's various systems. 2.2.1 Brain. The brain, a jelly-like substance, is the most important body part and is located in the head right under the skull. It is protected by a fluid and the skull, the bone part of the head. The anatomy and the functioning of the brain differ from one animal to another in a lot of different ways. With the help of our brain, we can survive through automatic processes like breathing, think, love, create, and remember. The brain is connected to the entire body through nerves, composing together the nervous system and making other body organs act. For example, when we see an object coming fast towards us, the eyes send the image to the brain. After the information is processed, the brain sends commands through the nerves to our muscles, making our body dodge. More functions of the brain include muscle control and coordination, sensory reception and integration, speech production, memory storage, and the elaboration of thought and emotion. Figure 2.8. Human brain. The brain is one of the largest and most complex organs in the human body. It is made up of more than 100 billion nerves that communicate in trillions of connections called synapses. The brain is made up of many specialized areas that work together. The cerebral cortex is the outermost layer of brain cells. Thinking and voluntary movements begin in the cortex. The brainstem is between the spinal cord and the rest of the brain. Basic functions like breathing and sleep are controlled here. The basal ganglia are a cluster of structures in the center of the brain. The basal ganglia coordinate messages between multiple other brain areas. The cerebellum is at the base and the back of the brain. The cerebellum is responsible for coordination and balance. The brain is also divided into several lobes. The frontal lobes are responsible for problem solving and judgment and motor function. The parietal lobes manage sensation, handwriting, and body position. The temporal lobes are involved with memory and hearing. The occipital lobes contain the brain's visual processing system. The brain is surrounded by a layer of tissue called the meninges. The skull, cranium, helps protect the brain from injury. Some of the most common brain problems. Headache. There are many types of headaches. Some can be serious, but most are not, and are generally treated with analgesics, painkillers. Stroke, brain infarction. Blood flow and oxygen are suddenly interrupted to an area of brain tissue, which then dies. A blood clot or bleeding in the brain are the cause of most strokes. Intracerebral hemorrhage, any bleeding inside the brain. Concussion, a brain injury that causes a temporary disturbance in brain function. Traumatic head injuries cause most concussions. Cerebral edema, swelling of the brain tissue in response to injury or electrolyte imbalances. Brain tumor, any abnormal tissue growth inside the brain. Whether malignant, cancer, or benign, brain tumors usually cause problems by the pressure they exert on the normal brain. Hydrocephalus, an abnormally increased amount of cerebrospinal brain fluid inside the skull. Usually this is because the fluid is not circulating properly. Normal pressure hydrocephalus, a form of hydrocephalus that often causes problems walking, along with dementia and urinary incontinence. Pressures inside the brain remain normal, despite the increased fluid. Meningitis, inflammation of the lining around the brain or spinal cord, usually from infection. Stiff neck, neck pain, headache, fever, and sleepiness are common symptoms. Encephalitis, inflammation of the brain tissue, usually from infection with a virus. Fever, headache, and confusion are common symptoms. Traumatic brain injury, permanent brain damage from a traumatic head injury. Obvious mental impairment or subtler personality and mood changes can occur. Parkinson's disease. Nerves in a central area of the brain degenerate slowly, causing problems with movement and coordination. A tremor of the hands is a common early sign. Huntington's disease. An inherited nerve disorder that affects the brain. Dementia and difficulty controlling movements, chorea, are its symptoms. Epilepsy. The tendency to have seizures. Head injuries and strokes may cause epilepsy, but usually no cause is identified. Dementia. A decline in cognitive function resulting from death or malfunction of nerve cells in the brain. Conditions in which nerves in the brain degenerate, as well as alcohol abuse and strokes, can cause dementia. Alzheimer's disease. For unclear reasons, nerves in certain brain areas degenerate, causing progressive dementia. Alzheimer's disease is the most common form of dementia. 2.2.2. The lungs. The lungs are two sponge-like, cone-shaped structures that fill most of the chest cavity. Their essential function is to provide oxygen from inhaled air to the bloodstream and to exhale carbon dioxide. Humans have two lungs, the left lung and the right lung. They are of different sizes and are divided into multiple lobes. A healthy lung has a pinkish appearance, and if you could see it outside the body, it would look like a squishy, rubbery structure. The lungs are located a little toward the posterior part of the human body, just below the collarbone, extending down to the diaphragm, the muscular partition that separates the chest and abdominal cavities. The left and right lungs are situated on the two sides of the body with the heart, another vital organ in the thoracic cavity, located a little in front of and at the middle of them. They are also surrounded by the rib cage, along with other organs in the chest cavity. Structure and anatomy of the lungs. A person's lungs are not the same size. The right lung is a little wider than the left lung, but it is also shorter. The right lung is shorter because it has to make room for the liver, which is right beneath it. The left lung is narrower because it must make room for the heart. Typically, a man's lungs can hold more air than a woman's. At rest, a man's lungs can hold around 750 cubic centimeters of air, while a woman's can hold around 285 to 393 cc. Each lung has an apex, base, root, and hilum or hilus of the lung, as well as three surfaces, keeping the lung connected to the sides of the thorax. The apex is the superior part of the lungs, with its highest point located above the first rib, extending through the superior opening of the thoracic cavity into the inferior floor of where the neck starts. The base is the concave lower surface of the lung that rests over the diaphragm. Structures including the bronchus, bronchial veins and arteries, pulmonary artery, two of the pulmonary veins, pulmonary plexus of nerves, anterior and posterior, and lymphatic vessels bundle together to form the root of the lungs. This root not only connects the two lungs with each other, but also keeps them suspended in the thoracic cavity. The structures of the root enter, leave the lung via the hilum. It is the wide depressed area located just a little higher than the center of the medial surface of the lungs. Segmental anatomy. In adults, each lung is 25 cm to 30 cm long, with the right lung being a little larger than the left lung, as the former has 3 lobes while the latter only has 2. If the surface of the lungs could be spread out flat, the total surface area of the two lungs together would be over 40 times greater than that of the outer surface of the human body, making them one of the largest organs. Right lung. The right lung is divided into the superior, upper, middle, and inferior, lower, lobes. These are further separated into 10 segments. Left lung. The left lung is a little smaller than the right one to make space for the heart, and is divided into the superior, upper, and inferior, lower lobes. Even though there are only 2 lobes, the upper lobe has a projection, referred to as the lingula, meaning little tongue in Latin, that serves as an equivalent to the middle lobe of the right lung. Fissures of the lung. Both the left and right lungs have an oblique fissure separating the superior lobes from the inferior lobes, while in the right lung there is a horizontal fissure to keep the middle and superior lobes apart. Surfaces and borders of the lung pleura and pleural cavity. A pleura is a two-layered serous, fluid-filled membrane that covers the lungs, providing a cushion to protect it from trauma and also to facilitate the process of respiration. There are two pleurae in the human body, covering the two lungs. The outer layer, or parietal pleura, lines the inner walls of the chest cavity, while the inner or visceral pleura is attached to the outer surface of the lungs. The two layers form a hollow space between themselves, which is known as the pleural cavity and is filled with pleural fluid, so the two pleural layers do not stick to each other. Mediastinum, or the space between the two lungs, the area around the middle of the thorax between the right and left pleural sacs, is known as the mediastinum. The space is divided into the inferior and superior mediastinum. The inferior mediastinum is larger between the two and further separated into the posterior, middle, anterior, and mediastinum. Diaphragm. It is the convex or dome-shaped sheet of muscle that both the lung bases rest upon. The diaphragmatic surface of both the lungs is concave to accommodate the shape of the diaphragm. It is one of the vital muscles in the respiratory system. It separates the chest cavity from the abdominal cavity. The three lung surfaces: costal surface, the convex, smooth surface, facing the inner surface of the wall of the thorax. It covers the largest area among the three surfaces of the lung. The costal pleura keeps it separated from the ribs and the deepest intercostal muscles running between the ribs, keeping the rib cage flexible. Mediastinal surface. The surface between the left and right lungs, it houses the hilum. It also covers the part of the lungs next to the heart. The left lung has a deep indentation, referred to as the cardiac notch, along its mediastinal surface to make space for the apex of the heart. These two surfaces meet each other at the apex, while they are separated at the base by the inferior border of the lung. The smooth and rounded area at the back, where the costal surface and the mediastinal surface meets, is marked as the posterior border. Diaphragmatic surface. As the name suggests, this is a concave basal surface facing the diaphragm. The right lung has a deeper concave base as it is positioned higher to make space for the liver located beneath. Respiratory area of the lungs, lung parenchyma. These are structures in the lungs directly responsible for the function of respiration collectively form the lung parenchyma. It includes the bronchial tubes, blood vessels, alveoli, and alveolar ducts. Bronchi and bronchioles. As the windpipe reaches the lungs, it divides into the left and right primary bronchus, which then enters the left and right lung respectively. Once inside the lungs, the bronchi divide into narrower tubes called bronchioles, while this again branch into terminal bronchioles, the smallest respiratory tubes in human lungs. This intricate structure in each lung is called the bronchial tree. Both bronchi and bronchioles are encircled with hyaline cartilage rings to help them maintain their shape. Alveoli. Tiny air-filled sacs. Alveoli are the primary functioning units of the lungs, the actual site of gas exchange. A healthy person has 300 to 700 million alveoli, 480 million in average, meaning there are around 150 to 350 million alveoli in each lung. The inner walls of the alveoli are lined with a thin layer of water and surfactant, known as the pulmonary surfactant, a protein-lipid mixture secreted by type II alveolar cells. It plays a crucial role in reducing the surface tension of the alveoli to prevent them from collapsing during gas exchange. This, in turn, helps the lungs to maintain their shape. Vasculature of the lungs. Each lung has one pulmonary artery and two pulmonary veins. The pulmonary artery carries deoxygenated blood to the lungs where it receives oxygen and then is carried back into the heart by the pulmonary veins. There are usually two bronchial arteries on the left and one on the right to supply the lung roots, visceral pleura, bronchi, and other supporting lung tissues with oxygen-rich blood. The bronchial veins drain the bronchi and the structures in the hilum, as well as some other supporting structures. Functions of lungs. The lungs are responsible for inhalation and exhalation, the method in which the body gets oxygen and gets rid of carbon dioxide. An adult person generally takes 15 to 20 breaths per minute and about 20,000 breaths per day. Function of lungs in respiratory system. Gas exchange. When we inhale, the air enters through the nasal cavity, traveling down via the pharynx, larynx, and trachea to enter the lungs via the two primary bronchi. Then it reaches the alveoli, the small air sacs in the lungs where the gas exchange occurs, through the bronchioles. The one-cell thick walls of the alveoli have an intricate network of blood capillaries. As the oxygen-rich air reaches these alveoli, the blood flowing through the capillaries takes up the oxygen in the method of diffusion occurring across the thin walls of the alveoli and the capillaries, the process in which a substance moves from an area of low concentration to area of high concentration. Similarly, the carbon dioxide carried by the blood from the different organs and tissues of the body are absorbed by the alveoli so they can be excreted along with the exhaled air. Total lung capacity, TLC, and lung compliance, TLC, refers to the maximum volume of air the lungs of an adult person can hold. It is the sum of the air released by the lung after a maximum exhalation, vital capacity or VC, and the volume of air left behind within the lungs after a deepest exhalation, residual volume or RV. The TLC of human lungs is 6 liters. Lung compliance is the measurement of the lung's capacity to expand with the changes in air pressure during breathing. Both TLC and lung compliance are measured for the diagnosis and treatment of various lung disorders. Function of lung muscles. The lungs function as a pair of bellows, pulling in fresh air into the body when they expand, and expelling the impure air when they compress. However, there are no muscles in the lungs to control this expansion and compression. The diaphragm helps in pumping the lungs with the help of the abdominal muscles and intercostal muscles. The diaphragm and abdominal muscles contract and expand to increase and decrease the volume of the lungs, while the intercostal muscles control the space within the rib cage. During inhalation, the diaphragm relaxes and extends towards the abdominal cavity to make the air from outside rush into the vacuum within the lungs, with the intercostal muscles making sure that the rib cage has enough space to accommodate the inflated lungs. Similarly, during exhalation, the diaphragm pushes upward into the lungs so they recoil, putting pressure on the alveoli, which then expel the carbon dioxide-rich air. Air purification function of lungs. When we inhale, the air that enters the respiratory tract is usually full of impurities like dust particles, pollen, etc. Some of these get trapped in the nasal cavity by nose hairs to cleanse the air partially. The rest of the cleaning is done by the mucous membrane lining the airways, the trachea, bronchi, and bronchioles, where any remaining foreign particles are trapped in the sticky mucus secreted by goblet cells. It makes sure no harmful substance comes in contact with the blood capillaries during gas exchange. Then, the respiratory cilia, the tiny hair-like growths covering the inner walls, sweep the impurities stuck in the mucus back towards the opening of the respiratory tract, where they can be excreted through the nose or mouth. Circulatory function of lungs. The oxygen-rich blood travels through the pulmonary veins into the left atrium, and then the left ventricle of the heart, from where it is pumped out to reach each and every cell in the body. Then, the cells receive the oxygen and send the carbon dioxide produced by the cellular functions into the blood to be carried by the superior and inferior vena cava veins to the right atrium, from where it reaches the right ventricle. This deoxygenated blood is then pumped back to the lungs by the right ventricle via the pulmonary artery. There, it releases carbon dioxide and gets oxygen so it can again supply the whole body. Diseases and associated conditions of the lungs. Lung cancer. There are 3 types of this lung cancer: non-small cell, small cell, and lung carcinoid tumor. These 3 vary in their rate of growth of the cancerous cells, requiring different treatment options. The non-small cell type is the most commonly occurring lung cancer, with subtypes including squamous cell carcinoma and large cell carcinoma. Excessive smoking is one of the most common causes of lung cancer, and common symptoms include wheezing, coughing up blood, and breathing troubles. Standard treatment measures include chemotherapy, radiation, and surgery. Asthma. One of the most common breathing and lung-related disorders, asthma is characterized by inflamed and swollen airways that make it difficult for air to pass through them, leading to symptoms like shortness of breath, congestion, wheezing, coughing, chest tightness, and fatigue. The condition also leads to excess mucus production, which accumulates in the airways, blocking them. Asthma has no cure, with treatment including medications, inhaler, and certain lifestyle changes for management. Pneumonia, a condition usually caused by a bacterial infection. Pneumonia leads to inflammation and fluid accumulation within the alveoli of the lungs. It may cause chest pain, trouble breathing, congestion, fever, sweating and chills, coughing, and appetite loss. Treatment includes antibiotics and other medications, along with lots of rest. Lung infections. There are a number of fungal and bacterial infections that can affect the lungs, including aspergillosis, caused by Aspergillus fungus, fungal pneumonia, and bronchitis, can be bacterial or viral. These may result from an allergic reaction to something you inhale, such as mold, certain chemicals, or if you come to direct contact with some contaminated substance. The liver is an abdominal glandular organ in the digestive system. It is located in the right upper quadrant of the abdomen, under the diaphragm and on top of the stomach. The liver is a vital organ that supports nearly every other organ to some capacity. The liver lies on the right side of the abdominal cavity beneath the diaphragm. Its main function is to process the contents of the blood to ensure composition remains the same. This process involves breaking down fats, producing urea, filtering harmful substances, and maintaining a proper level of glucose in the blood. Human liver structure. Liver is the organ with most secretes in our bodies. It is the hottest internal organs with incredible regenerative capacity. Sitting to the left of the belly, liver is the largest internal organ that supports almost every other organ in your body. It has a reddish-brown appearance and feels rubbery to the touch. This vital organ is responsible for hundreds of chemical reactions that are necessary for the chemical factory of your body. Liver works tirelessly 24/7 and performs over 500 functions vital to your life. As a gland, liver secretes bile, which is emptied into the small intestine to facilitate digestion. The liver is the body's second largest organ. Skin is the largest organ, weighing about 1.4 kilograms. At any given moment, the liver holds about half a liter of blood, i.e., about 13% of the body's blood supply. The liver is shaped like a cone and consists of 2 main lobes. Each lobe has 8 segments that consist of 1,000 small lobes, or lobules. The lobules are connected to ducts that transport bile to the gallbladder and small intestine. The human liver size. Different factors like age, gender, and body size affect the liver size. It is bigger in human males than that in females. The size of this gland is around 10.5 centimeters for men and about 7 centimeters for women. In the similar way, the liver weight is also different in different genders. Normal liver weighs about 1.2 to 1.5 kilos in females and males, respectively. A thin, double-layered membrane makes a covering around it. This covering is called the peritoneum. It is this peritoneum which minimizes friction of the liver against other organs. Functions of the human liver. The liver has a complex role in the function of the body. This glandular structure in the abdomen has potential to perform over 500 different functions. All these functions are of vital importance for the body. The job of the organ ranges from acting as storehouse for different substances to making important secretions. Interestingly, the hepatic secretions are of both endocrine and exocrine nature. However, the primary job is to purify the body from different harmful substances, for example, toxins. On the other hand, as a gland, it secretes chemicals in the form of bile or liver juice. Bile contains salts that neutralize the acidic food coming from stomach. Meanwhile, the bile juice also helps in the digestion of fats. In the presence of bile salts, the fatty substances break down into smaller, simpler pieces. Afterwards, these small particles move into the blood across the wall of small intestine. Here follows a brief description of some of the major functions of the liver. Liver as a filter. The liver function requires it to serve as a filter between the blood that comes from the gut and the blood that circulates in the rest of the body. It clears the bacteria, antigens, damaged cells, proteins, hormones, and drugs from the portal circulation. From the variety of the functions of the liver, it becomes obvious that your body cannot afford any disorder of this organ. Its malfunctioning can have drastic effects on overall health of your body. Processing nutrients. Liver is the organ which receives almost all the nutrients that come from our digestive tract. However, chylomicrons are an exception, i.e., the liver does not process them. Chylomicrons are a type of complex lipids. These are mainly the lymph vessels that transport them across different parts of the body. Liver processes all the nutrients present in the food we eat where the energy is stored. On the other hand, when necessary, it mobilizes the stored energy for use throughout the body. So, in a sense, liver acts like an interface between the circulatory blood and the digestive system. Blood reservoir. The liver is a storehouse for large quantities of blood. When the total volume of the blood increases in the body, the liver quickly expands to store it. In other words, it can act like a blood reservoir. In instances of cardiac failure, there is high pressure in the right atrium of the heart. Such a condition causes back pressure in the liver. This forces the liver to expand. The liver can then store about 500 to 1,000 milliliters of extra blood within its own tissues. The liver can also supply the body with this extra blood in times of low blood volume in the body. Synthesis and storage of glycogen. The liver plays a key role in carbohydrate metabolism by converting glucose to glycogen. In this way, it prevents hyperglycemia or high blood glucose after a meal rich in carbohydrate. Conversion of glycogen to glucose. Liver converts the stored glycogen to glucose and releases it into the blood. This conversion occurs in response to low blood glucose level. So, your body can maintain a stable blood glucose level during fasting state and between meals. Restoration of glucose level. When there is a decline in the blood glucose level, the stored sugar is converted into functional sugar. Glucose from non-carbohydrate compound. Sometimes there are no glycogen reserves left in the body. In such a situation, liver comes to play its role. It can also convert non-carbohydrate compounds, such as lactic acid, amino acid, to glucose. Unreasonably high output of hepatic glucose occurs in patients with diabetes mellitus. Consequently, there is disturbance in the functions of the liver. Certain anti-diabetic drugs are useful to reduce hepatic glucose output. Synthesis of blood clotting factors and other plasma proteins. Liver synthesizes various plasma proteins. They include albumin, blood clotting factors, apolipoproteins, angiotensinogen, and insulin, etc. The blood clotting factors are fibrinogen, prothrombin, and factors VI, VI, XX, etc. Liver replaces the plasma proteins in days to weeks after a major blood loss from the body in case of an accident. Synthesis of glycoproteins, enzymes, etc. Functions of the liver also include the synthesis of various important compounds in addition to plasma proteins. Synthesis and secretion of transferrin, globulins, and other such compounds also falls under the domain of liver. Detoxification of poisons and drugs. One of the functions of liver is to detoxify poisons and drugs. It involves the phase L and phase L biotransformation reactions. If these poisons and drugs keep on circulating in the blood, they would harm and damage different delicate tissues and organs. They can also have severe effects on the heart muscles. It will eventually lead to the malfunctioning of this vital organ. So, detoxification of drugs and poisons is an extremely important liver function. Conversion of ammonia to urea. Liver removes ammonia from the blood by converting it to a less toxic compound, urea. Accumulation of ammonia and other toxins may eventually cause hepatic encephalopathy, confusion, and coma. In liver cirrhosis, there is an increase in the blood ammonia to toxic level. This occurs due to disturbance in liver function. Lipid metabolism. The liver function also includes the metabolism of lipids. It serves the job of formation of ketone bodies, preservation of cholesterol homeostasis, synthesis and secretion of very low-density lipoproteins, VLDL, clearance of high-density lipoproteins, HDL, low-density lipoproteins, LDL, and chylomicron remnants. Alcohol metabolism. Metabolizing alcohol to acetaldehyde is another liver function. The excess amount of alcohol is directly toxic to the liver cells. The production of acetaldehyde occurs through the action of the enzyme alcohol dehydrogenase on alcohol. Synthesis of bile. As one of the functions of the liver, it plays a central role in the synthesis, secretion, and metabolism of bile. Bile is a fluid that may vary in color from dark green to yellowish brown. The gallbladder stores and concentrates the bile. The bile contains bile salts, inorganic salts, fats, and bilirubin. This hepatic secretion aids in the digestion and absorption of dietary fats across the wall of small intestine. It is also a major excretory route for lipid-soluble waste products. Storage of vitamins and iron. The uptake and storage of vitamins A, D, B12, folic acid, and iron is also a liver function. The body uses these vitamins at the time of need. Storage of minerals. Liver stores certain minerals such as iron and copper. Iron is an essential ingredient for blood production. Most of the body's iron occurs as a part of hemoglobin and myoglobin. Here, hemoglobin is an oxygen-carrying protein, while myoglobin is the oxygen-binding protein in muscle cells. On the other hand, copper is a constituent of various proteins and metalloenzymes. In this capacity, the mineral plays an important role in the processes of development and proper growth. It is also useful for the maintenance of heart, brain, bone, and other organs of the body. Destruction of old RBCs. Your body should get rid of the old red blood cells that are of no use anymore. Liver performs the job of destroying the old RBCs. After that, it becomes easy for the body to remove them. In short, the liver performs a great variety of tasks, ranging from the synthesis, storage, and secretion to detoxification of harmful substances. Different secretions are of great metabolic importance. The liver function in digestion is also very significant. Regenerative capacity of liver. Most cells in the liver are hepatocytes, around 60%. The remaining cell types are Kupffer cells, stellate cells, endothelial cells, and bile ductular cells. When there is the loss of functional cells or hepatocytes, the growth factors and cytokines, etc., induce proliferation of the remaining liver cells. This is the very reason that when you surgically remove some part of the liver or it suffers from some damage due to any other injury, the remaining hepatocytes can trigger liver regeneration. Thus, you can expect the complete recovery from the injury. Signs of liver disease. Jaundice is the hallmark sign of liver disease. At the same time, it may be the most reliable marker of the severity of the condition. Typical symptoms of liver disease include icterus, jaundice, fatigue, nausea, poor appetite, discomfort or pain in the right upper abdomen, intestinal bleeding, Abdominal distension. Many patients may not have the above symptoms, but the biochemical liver test will help confirm the disease. Risk factors for liver disease. As a part of special care of liver, you need to eliminate the risk factors for liver disease. Here follows a brief description of some of the common risk factors. Alcohol consumption. Alcohol is the leading cause of liver disease in many parts of the world. Next comes the turn of hepatitis C and B virus infection. More than 2 drinks per day in women and more than 3 drinks per day in men can increase the risk of alcoholic liver disease. Recreational drug use. Everything that the nature has created has some benefits, but its excessive and unwanted use can prove to be problematic. Smoking, recreational use of marijuana, and snorting cocaine are potential risk factors for liver disease. Hyperlipidemia. The levels of lipids and lipoproteins in the blood may get abnormally high. This is the condition of hyperlipidemia. Such a condition increases the possibility for liver to suffer from a disease. Genetic diseases. There are individuals who have a family history of cirrhosis, Wilson's disease, hemochromatosis, diabetes, or endocrine failure. This may also serve as a risk factor for the liver disease. Viral hepatitis. Intimate or occupational contact with individuals suffering from viral hepatitis can be the cause of hepatic disorders. Exposure to affected blood. Accidental exposure to blood of a victim of liver disease will make you susceptible to the same condition. Recent surgery. Sometimes after surgical operations, the process of healing may go bad. In turn,